moods. You're happy, you're sad, you're crying, you're mad, all of that stuff. All of those are signs of perimenopause. You know, every day in practice, I get to talk to women, and so many of them are just frustrated with their hormones. They don't know what's going on. They don't know if they're in menopause or perimenopause. They're so confused. And often we have to sit down and sort of peel back the layers on all of this to help them understand what's happening with their bodies. Has that ever happened to you? Well, let's talk for just a second about perimenopause. I feel like there's so much confusion about this particular stage of a woman's life. I feel like we understand menopause, right? Everybody understands that menopause is defined as not having a period for at least a year. Sometimes you can look at your numbers, like an FSH and some others, to kind of understand what your body's doing. But perimenopause, a lot more vague. Here's why. It is vague and it is variable. Perimenopause can begin anywhere as early as 30, 32, and it can last all the way to 55, 56, even up to 60 for certain women. Here's why. Perimenopause is really defined by that stage of a woman's life when her hormones just start to get more irregular. And it really begins actually up here, right in the pituitary, because our pituitary gland stimulates our organs to produce estrogen and progesterone and testosterone, which help us to have a period and help us to stay regular. When we're in perimenopause, there's something called the loop phenomenon, where it just kind of loops all over the place. You know, one month you may have a nice, strong, regular period. The next month, it disappears, and then it shows up again. In today's environment, we are seeing younger and younger women go into perimenopause much earlier. Part of it is the incredible stress so many women bear nowadays. They're juggling big careers, families, responsibilities for parents, and so much more. A lot of them too are breadwinners. If you like this video, don't forget I post new YouTube videos every Thursday. Just hit like and subscribe. All of this collective stress really puts stress right here again on that pituitary. So the pituitary starts to get confused, and it's like, wait, do I need to preserve this guy or this guy? Do I take care of the thyroid or the ovaries or the uterus? What do I do? So the burden of stress, or superwoman syndrome, as I've been calling it over and over again for the last few years, is really taking a toll and impact on women's hormones. That's why we've got to talk about perimenopause. What are the symptoms of perimenopause? Well, it's all of that. The irregular periods, having these random hot flashes and not knowing where they're coming from, the mood swings, you're happy, you're sad, you're crying, you're mad, all of that stuff. All of those are signs of perimenopause. Another sign that many women ignore is sleeplessness, just not being able to get a good night's sleep. And then the other sort of sly symptoms, or is what I call them, the creepers, so to speak, where there's that slow weight gain, there's the loss of muscle mass, and there's the loss of libido, maybe some anxiety and depression as well. So perimenopause is nothing to be made fun of. And yes, so many people talk about women and their moods and relate it to their cycles. But look, this stuff is real and it affects lives, it changes lives, and it can just change the sense of who you are and who you feel like you may be. Well, that's what perimenopause is. But what do you do about it? What are your solutions? What are your options? And here's the challenge. Here's what really, really upsets so many women that I meet. They'll walk into the doctor's office, they'll tell their story of all their symptoms, and usually, guess what you guys walk out with? A prescription for an anxiety medication or a medication for depression. And that's the explanation. End of story. Most of you are not able to get your hormones checked. Most of you don't have a conversation of how your hormones can be balanced. And sometimes you'll have that conversation of how your hormones can be balanced, but guess where it leads? It leads straight to hormone replacement. And hormone replacement has a role, absolutely has a role in women's health. But here's the deal, it shouldn't be the first stop. It should not be where we begin. You can and you should balance your hormones naturally. Now, in many of my videos on my page, I talk a lot about the foods to balance hormones, natural hormone solutions, and really dig into the connection between gut health, stress, sleep, and your hormone balance.